Hello everyone, this is Royal Dental Services once again. Let me hope you're fine. We are located in the heart of the Holo City, Hoima. So I'm going to begin a series teaching about the children's dentistry. So basically I'm going to be talking to parents for these few series. And I've been having so many questions about children's teeth. My kid is now 3 years, the teeth are not yet all in. My child is 4 years, the tooth is shaking. My boy is 9 years, but he still has the shaking teeth. So I'm going to answer all this in this next series. So please, if you're a parent, stay tuned. And for your babies, yes, you can also join us. So for today, I'm just going to first give you a background about milk teeth. There's what we call milk teeth. Some people call them baby teeth. Some call them deciduous teeth. So whatever you call it, it is this set of teeth that come in between the age of 6 months up to around 3 years. Those small teeth. So basically, your child, a normal child, will have 20 teeth. 20 teeth in total, whereby we have 10 up and 10 down. These teeth basically will be, by the time your baby is born, they are all in the jaw. All of them, the 20, they are in the jaw. And when by the age of about 6 months, they will begin now appearing in the mouth. So these teeth begin to be formed when you're still pregnant. When the baby is still in the belly, the teeth are being manufactured. By the time of birth, they are already manufactured, only that now they are still as seeds under the gum. So they begin showing up at about 6 months. Normally, all the 20 teeth will have appeared by the age of 3 years. That is at 6 months. All the 20, they're supposed to be there. And sometimes, actually in most cases, when your baby is beginning to get these teeth, sometimes they get sour gums, sometimes the gums are itching. This is when you see your baby picking anything they pick, it is into the mouth. They pick a stone, they want to bite on it. They pick your sandal, they want to bite on it. They are simply trying to soothe or to scratch that part where the tooth is going to erupt from. So sometimes the gums are tender, they begin getting some pain, and maybe when they are eating or breastfeeding, you realize they are no longer as effective as they've been suckling. So it is just that the tooth is coming in. So normally we suggest you can get them. It's called a teething ring for your babies to suck on, so that you can avoid the cost of treating infections. So, but basically, I'm going to go through now eruption dates. Very many of you have been complaining. My baby is now 1 year, but I'm not seeing teeth. My baby is this year old and he's not erupting. Yes, I'm going to put up a chart. I will organize the chart about your baby's date teeth eruption. So, this baby has 10 teeth, but basically the mouth is divided into four, where we have the upper right, lower left, and lower right. So I'm going to just handle one half, one quarter, and you'll understand all the dates. So we have the central incisor, we have the lateral incisor, we have the canine, we have the first molar, and we have the second molar. So your baby will have 5 teeth in each quadrant. So 5 here, 5 here, 5 here, and 5 here. And the total is 20. The milk teeth or the baby dentition will not have premolars. So that's why we skip the premolar here. So your first incisor, let's begin with the lower jaw. Lower. The central incisor will come in at about 6 to 10 months. 6 to 10 months. Your baby is supposed to have had at least the 2 lower teeth coming in. Then the lateral incisor is 10 to 16 months. The canine, by this 16 month, at least your baby is supposed to have those other now 4 teeth in the lower jaw. The canine comes in at 17 to 23 months. Now, these months I'm stating here, they are not for every child. Just like people grow differently. Some will grow faster, some will delay, but it is normal. Don't worry if your baby is 7 months and doesn't have a tooth. It is okay. Wait until it is 10 or 12, then you can begin complaining. Okay? So your first molar will come in at 14 to 18 months. 14 to 18 months. And your second molar, or the very last big tooth in the baby's mouth, will come in at 23 to 31 months. 23 to 31 months. That is how. So it will be here and here. These ones are beaten. The lowers. Then with the upper jaw, we have also the central incisor, the lateral incisor, the canine, the first molar, and the second molar. So in your upper jaw, your baby's upper jaw, this first tooth will come in at about 8 to 12 months. 8 to 12. These are months, not years. Months. So you begin at the 8th month, you begin expecting a tooth in the upper jaw. Then lateral incisor, 9 to 13 months. 9 to 13 months. If I'm too fast, don't mind. I'm going to put up a well-organized chart in this video still. Most probably it's already there. Then a canine will be 16 to 22 months. 16 to 22 months. The first molar will come in at 13 to 19 months. This is almost 2 years. And your second molar, the last big tooth in your baby's mouth, will come in at 25 to 33 months. 25 to 33 months. I think we are now okay. So, if you're a parent, and recently I got a parent who said, "Doctor, my baby's lower teeth are coming, but the uppers are not coming." So, to a parent, it is puzzling. Maybe they explain that, these teeth will come in once, but don't mind. They have stages, they differ. And likewise, when time for shedding, or when the permanent teeth begin to come in, it is also different. They come in intervals. So, thank you very much for today. I think that is enough. Next time I'm going to show you when to expect your permanent tooth to come in. Thank you very much for watching. If you've not subscribe to Royal Dental Services Hoima on your YouTube. Or you can visit our Facebook page, Royal Dental Services Hoima. Thank you very much for being with us.